we were in the court with the 11 nurses that were arrested yesterday, and they were detained by the police overnight, and they've been taken to court today, this afternoon. And their charges is they said they have violated the COVID-19 regulations, and they were given a bail of 1,000 RTGS each for the case, and they were ordered to report once every week at the nearest police station. We actually not happy. We feel this is an unfortunate event where when the workers demanded a living wage, they end up in police custody, in police cells, and eventually at the courts. This is not democracy. This is not what we expect. We expect government to address the issues of the nurses amicably. These nurses were having their their meeting at Salim Gabe Central Hospital, and it's unfortunately the CEO decided to call the police and arrest the workers that they work with. And this event have triggered a wave of demonstrations among the health workers. Today there was a demonstration at Barrenyatwa group of hospital where all health workers, including the nurse managers who were still giving a skeleton services, who were still giving, covering the emergencies in the hospitals, they have down tools in solidarity with the arrested nurses. We also have seen the doctors, the senior doctors have joined the industrial action due to this provocation. To us as professions, we feel this is clear provocation of democracy, clear provocation of unionism. We need, government has to promote democracy, has to promote unionism in this country. The Constitution of Zimbabwe has to be respected by all arms of government, and we feel it was violated, which is unfortunate. And we now urge government to urgently address the issue of the nurses, because the moment that we are going to not address these issues, and that we are going to have more and more of our health workers joining the industrial action, we are going to see a lot of Zimbabwean being stranded, a lot of Zimbabwean dying in hospitals without any help. And that's, I don't think that's what the president wants in this country. We are in the middle of COVID-19 pandemic, where we expect the health workers to be respected. We expect the health workers in other countries right now as we speak. All the citizens are celebrating their heroes, who are the health workers. But in Zimbabwe, we are seeing the health workers who are the frontliners being arrested, which is totally opposite of what is happening in other countries. And what was promised by government, today we have seen some of our members receiving 50% that was being talked about by government. And that 50% was translated, it was on average 1,200 RTGS. 1,200 RTGS, you cannot even buy 10 years today in the black market with the 1,200 RTGS. And can we really go on top of a hill and say we have increased the health workers with the 10 years when they were getting less than 30 years? And that total, if you talk about it, they cannot even, it's not even enough to pay rent. Before we talk of paying maids, before we talk of buying groceries, basic commodities, before we talk of transport to go to work. So what is happening today, right now, is a total incapacitation of health workers. They don't have anything, anywhere to start for them to go to report to work. Health workers, for them to work, we work with sick people. These people, they need somebody who is psychologically, mentally stable. So the nurses are stressed. The nurses are psychologically traumatized because of the salary that they are receiving right now.
Thank you so much, Mr. Dongo. We greatly hope everything goes well for the Nurses Association.
Thank you very much.
Hello?
TGF initially stated proposed 2,000, which we feel previously was excessive, given that the others were fines in $500. So, and also that they report to their nearest police station, which were specified when reported. Yeah. Then we'll obviously be back in court on the 22nd. Yes. Well, why was it 4,000? Bail deposit 2,000.
Sorry, what does bail deposit mean?
It's a surety that while we are awaiting trial, you won't run away.
Sorry, does it mean every other COVID-19 person has been going in court and then getting a bail and then coming back to court?
I don't know. Need to do